Right. And God made us all different. So what works for one woman and her prescription isn't going to work for another. I mean, like it's very nuanced, and I think we're just not talking about taking a deeper dive on those types of details.
Yeah. And
Yeah.
when it comes to the formula or the delivery method or the dosage, it's different for everyone.
So different.
And then that's why it's this training that I went through was so brilliant because it really showed doctors that you need to be really close to your patient when you start her on hormone therapy because there is no one size fits all. And we want you to give her your email, give her whatever contact information that she can every day if she wants to get in touch with you and say, look, I'm feeling this, I'm not feeling that. Well, then you can help her self titrate until the next visit. And that was so important because I've met so many women who say, well, I tried hormone therapy, didn't work for me. I felt worse or I gained weight. Well, yeah, definitely that can happen, but you got to work through it. To find what works the
Right.
best, the right dosage for you, and they'd rather just deal with the hot flash and the night sweats rather than the weight gain, for example. And it's a pity because it just doesn't have to be that way.
It doesn't have to be that way. And you have a kind of a tagline. Menopause is, what is it you say?
Inevitable, but suffering is optional.
I agree with you. And I feel like now we're in a good space in our country where we're actually talking about menopause. There's some great books out, and my Instagram feed is full of women talking about menopause and different techniques, but to feel better. But 5 years, even 3 years ago, people weren't really talking about it. So I think it's a good time to be a woman in her 50s, mid 40s, moving toward that, because the information is starting to be talked about, which again makes me so happy.
Yeah, when you were going through menopause, like when did you start your sort of, let's say, perimenopause journey?
I would say for me, perimenopause started in my late 40s, and it started with the dry eyes.
Hmm. And were you aware of perimenopause, that
No
word, or
idea. No, I
neither
mean,
did
I'd
I?
heard the word, but I mean, how sad is that? I'm a certified nutritionist. I've been in this field for 30 plus years. And back then, so 15 years ago, nobody was talking about these things because it was probably in that, I use air quotes, disease category. And
Yeah,
yeah,
it's a taboo topic, and
right.
women definitely were not talking about it. I mean, did your mother talk to you about
Oh,
menopause
no.
ever?
Oh, no, no.
No.
I still haven't gotten my talk, if you know what I mean.
The
So I've
birds
been
and the
married for
bees.
20 years, and yeah, I figured it out, but I never got the talk. So we
Yeah.
didn't talk about things like that in the 70s. So
Yeah, and it's
yeah.
universal. I don't know if you've seen the reels I've done with women around the world, but
Yes.
as a nomad, I just go over and I stop women on the street. I ask them 5 questions about menopause. And so often, I mean, you don't see the rejection because I only post the ones who
Of
agreed,
course.
but there's so much rejection. And very often, it's most of the time it's, oh, I'm shy. I don't want to be on a camera. I understand that. Or my experience is so bad. I don't think you want to hear that. And I'm like, yes, I do.
Yeah.
But the worst was when I was in Czech Republic in Prague, and not only I got rejection, but I got a really nasty look, and it was a hard no and get out of my store kind of a thing. And I thought, oh, and it happened over and over again. I said, okay, there's something going on. And I started talking to the younger women. I said, should I get a translator? They said, no. It's basically you're stopping them and saying, hey, you look old. Can I talk about menopause with you? Which is not my intention. Hey, I'm in menopause too, but they really had a strong negative association with menopause that they really thought I was insulting them. And it's a pity because we want to change that stereotype. We want to change
Right.
things and open the conversation. But I found it, yeah, Czech was really hard.
Interesting. So the Czech Republic recently sounds like maybe the US 20 years ago or 30 years ago, where you're in menopause. It's a disease. You're old. You're not attractive anymore. You're not sexy. You're not, like all of those things. And you're basically dried up and put out to pasture. And that is so not the case
Yeah.
anymore in our country. And I'm so grateful for that.
Yeah, I
Yeah.
agree. We should have a word like we have ageism, but maybe there's menopausum or something.
You know what, Zora? I think we should just make it up and we should trademark it. As a So you've had a couple of surgeries,
Yeah.
and how do you feel you're aging?
So I feel great. Honestly, I feel I'm aging well. I try my best. I've got energy. Everything is going smoothly until I got osteoarthritis. And I was shocked. I didn't know what that was. I thought there's something wrong. There's a misdiagnosis. I had joint pain. And looking back, I'm thinking, wow, if I knew back then, it could have been really related to the loss of the hormones, right? We know hormone therapy helps with joint pain. It was very localized, always in my hips, and there are many reasons, and people come up with all kinds of reasons why. But from a medical perspective, there are 12 risk factors for osteoarthritis, and I had 9 of those. And
Oh my
so I was kind of
goodness.
set up for this.
Okay.
Osteoarthritis, to make it clear, because a lot of people confuse it with osteoporosis.
Mhm.
Fibrosis is the loss of bone density, right? Your bones are getting brittle and you are very predisposed to a fall and then a fracture, or a fracture and then a fall. And so this is something we can correct. You can reverse this. There's no problem. My bones are very strong. I've tested them. They're great. However, osteoarthritis is a degenerative joint disease. It's your joints that are losing the cartilage, and they lose it to the point where you have pain, you have immobile, you have no more range of motion or very limited swelling, and it's chronic. You're living with chronic pain.
That sounds
That's
terrible.
completely different. There's almost 7% in the world globally who are dealing with this osteoarthritis. There are happens more often to women than men. Menopause accelerates the
Mm.
progression. And there, I think, in the US, there are about 400,000 surgeries made every year for osteoarthritis. And most of the time it's done on knees. Knees are the biggest one. Hips, second, running seconds. So it's a pretty prevalent disease, but it's not as common happening to people or getting surgeries in their 50s or
Mhm.
40s even. It happens very often much later, but now I see, since I've been talking more about it, and I really appreciate you allowing me to talk about this, because there is a whole category of women who are doing quote unquote the right things, who are very athletic, who are healthy, and then this happens to them,
And
and they're
then
linked to
boom.
those
Yeah.
risk
Mm.
factors. But most often the ones, like say in the US, which are due to obesity. So if you Google
Oh,
what to do for osteoarthritis, well, lose weight. And I can imagine me Google searching, and I'm very athletic and I'm very happy with my body composition. I'm like, well, wait, that I can't lose any more weight. That's not
right.
going to be really good
That's not the
advice.
box I need to check.
Yeah. So for if you're in the category or obesity category, yeah, maybe you can avoid surgery by doing those things. But then what about all these other people who are trying to be healthy and exercise? Well, you don't stop exercising. You need to do other things. But out of those 9 risk factors, the top 3 are your age and your gender. Being female, you're more predisposed, and genes. So those are 3 you can't really do much
You can
about.
do nothing about those 3 things.
That sets you up. And then if you have injuries, if you're athletic, these
Mhm.
again, more predispositions, going through menopause, loss of hormones, and it accelerates this process. But this is something that most people say you cannot reverse. However, I've been working with a doctor who says you can. But I
Ooh.
personally think for me, it was a little bit too late. And again, everyone's a different case. And again, if obesity is your thing and you lose the weight, well, then maybe you can avoid
Mhm.
surgery. You don't need to, or maybe you delay it a long time. And there's a lot of things we can do to delay surgery, but it's much harder. So that's why osteoarthritis is much harder to deal with than osteoporosis, where you can grow back your bone and make them stronger. So yeah,
Right.
that's my story. And then it just got to the point where all my biohacks weren't working anymore. They were fabulous in the beginning, and then
Hmm.
I decided, okay, it's time for surgery because my quality of life is taking a
Oh,
nosedive. And so I got to experiment. I mean, once you decide on a surgery, your mindset shifts. At least my mindset shifted, and I said, "That's it. I'm going to become bionic. I'm going to be stronger, better,
I
faster. I'm going
love
to be
that.
amazing." Jamie Summers is my hero.
I know. I was trying to remember that gal's name. Right. It's a
Bionic
$6 million
woman.
dollar woman. Yes.
And then you get so excited for the surgery because if you anyone who speaks to somebody who's had a hip surgery is so happy. Like they're so excited for you because they know what it's like to live in chronic pain and they know how much better it is on the other side. And what this experience has taught me as a gerontologist, I used to be a little cocky about people who have chronic joint pain. I'm like, well, they're just not exercising, they're not moving, and this happens, so you got to move. But now I realize, you know what? Sometimes you just can't. And I've reeled that in and said, and have a lot more empathy because I've lived in the body of somebody who's living with chronic pain. I see people and I can see those people in the street now, especially the older adults who are limping, that they've got some pain. And I know what they're going through. And I really think that if you have the opportunity, I've been having the luck and the privilege to be able to have a surgery because there are a lot of people who don't have
That's
that.
so true.
And I
Yeah.
just, again, that was part of my mindset shift of people saying, oh, I'm so sorry, you're going to get a surgery. I'm like, no, I'm happy for me.
Right. Because this means you get to get out of chronic pain, hopefully, best case scenario.
Yeah.
Wow. So, a couple things. I want to hear about the biohacks that you did to postpone surgery as long as you could. And then I also want to hear you speak to, kind of the new you, meaning a new mindset of looking at people who were dealing with joint pain. And it sounds like you were walking in their shoes.
Yeah, absolutely. So there were a lot of things that worked, more things that didn't work than worked for me. And I have a list of probably like 100 things because when you are living with chronic pain, you are desperate. You will spend any kind of money to feel
It's true.
better. And I have to say the things that didn't work for me doesn't mean that they won't work for you.
Mhm.
I've tried these things because there's been plenty of people who said this helped me. Again, I don't want to like say acupuncture, for example, didn't work with me, but it's relieved a lot of people with their pain. Hormone therapy didn't work for me. And I think that's any woman who's listening now who's dealing with joint pain, that's kind of the low hanging fruit because I have had so many women in our community start hormone therapy and suddenly their joint pain is gone. I wish that were me.
Wow. Okay.
But it's happened, frozen shoulder or arthritic
Yes.
fingers, hip pain. And it is possible that when I started hormone therapy 5 years ago, I was on very baby dosages because the
Mhm.
doctors I was working with I didn't have classic symptoms. I just wanted prevention and I wanted relief from my hips.
Sure.
And I wasn't up to speed on where I needed to be with my hormones. I was just learning through the whole process. So I have a feeling that perhaps if I increased my dosages or I had robust dosages, maybe I could have delayed it a bit more because
Yeah.
I think part of my situation was my genes and my injuries from the sports that I would do. So I think low hanging fruit is like anyone like, please just look at the hormone piece. The things that worked for me were PRP, platelet rich plasma. And these are injections where they take your blood from your arm, spin it in a centrifuge. 15 minutes later, they re inject it into the joint. And that is brought me bouncing back. However, the research shows about oh gosh, it ranges from like 30% to 80% success rate, right? Let's call it 50%. And I have to say,
Okay.
in my experience with the people I've recommended PRP to, it's kind of hits around that point where about 50% get relief and 50% no.
Those are good numbers though.
Yeah. Yeah.
Yeah.
It
Okay.
tops the dice, but you think, well, and it's an expensive therapy. So I think it's kind of, and unfortunately, insurance doesn't cover it, but that has
Yeah.
really bought me years. I would do it every couple of years and
Huh?
bought me some more time.
That's
And
amazing.
well,
Okay.
it doesn't work anymore, but that was
Yeah.
really good. And you can also look into exosomes. Exosomes come from stem cells. And these are also fabulous for any issue that you have in the body. And that can help. I've done a couple of podcast interviews on stem cells versus exosomes
Mm.
because everybody's like, oh, stem cells. But then that is way more expensive and actually not evidently as effective. And this is something for people another rabbit hole to go down if you're dealing with any kind of joint pain or even skin. I still have to try them for my skin
Mhm.
and for a lot of other issues. But exosomes are really, really cool.
Okay.
And then
I'm taking copious notes right now.
another thing that worked really well for bringing pain relief was red light therapy. Red
Yeah.
light therapy is usually a device. It could be a panel. It could be a thing that you put on a body part. Actually, I have it right here because I use it friggin' every single day. This one
Hmm.
you put on a body part, on kind of shoulder or your hip, and then it emits red light. And that red light, depending on the frequency, because you have red light therapy masks, which are very low frequency because it doesn't
Right.
need to penetrate deep into the tissues. It just needs to get on a more superficial level, and it helps rejuvenate and the skin as well as activating collagen and blood flow. But when you're looking at it from a joint perspective or pain-free perspective, it gets deep into the cells. It gets into the mitochondria and it activates ATP. So
Mm.
ATPs are energy powerhouse, and then the
Yep.
body can kind of get to work for repair, rejuvenation, and then it brings in more blood flow, lowers inflammation, a lot of cool stuff. It's pain free. It
Right.
doesn't hurt. It doesn't, you don't feel anything. You just kind
Hmm.
of lay it on. Some people feel immediate relief. Some people feel it after doing it, using it for several weeks. And there's a whole protocol. You don't, it's not a more the better kind of thing. You don't want to overdo the red light therapy either.
Right.
But it's a really cool hack that worked for me, especially on days I was walking a lot. And then I was like, oh my God, I could feel it in the hips. And I just
Right.
lay with this lovely little device on me. So
Hmm.
that was another thing that worked really well. And I've tried all the diet and the anti-inflammatory diet stuff. I'd still recommend it highly for
Hmm.
sure. Whether or not it helped, help for me, I tried, believe me, the lectin-free diet and the anti-inflammatory diet. I
Yeah.
still generally eat like that, but it didn't quite move the needle for me. But I still highly, highly recommend it no matter what.
Hmm.
And then your rehab exercises, like as limited mobility as maybe you have, if you mean whether it's your arm or your knee or your hip, it's really important you keep the muscles strong.
Hmm.
You want to create space, and at least for me in the joint, it was all about let's work the glutes, let's try to keep the space. And maybe I was able to go on for a lot longer because I was always working on that as much as
Yeah.
I could with a trainer. And you get a physio or a rehab or a therapist. These are things that are absolutely crucial. And then if you need surgery one day, well, you're prepped.
Yeah.
You trained for your surgery, because then you will have a very fast recovery
Hmm.
because you've worked on that muscle. So those are some of the things I think that really work for me. I know I'm probably forgetting a ton more, but yeah, those are kind of the big drivers.
Yeah.
The other thing that I didn't try actually, which well, there was another thing that didn't work, but I would say if anyone's dealing with osteoarthritis, go down this rabbit hole. And it's a drug called pentosan polysulfate. And it is used in racehorses historically. And then they had these human trials, and the research is really good for humans. And I saw a doctor is from the Boulder Longevity Institute, Dr. Elizabeth Ewers. She's fabulous in regenerative medicine, works on 80% of her patients, she herself as well, who's got end stage osteoarthritis in her knees. And it's an injection, it's a drug, and it's kind of pain to do, but I think it's there's some hope there because the benefits of this drug were unbelievable in terms of anti-inflammatory, anti-cancer, antibacterial, antiviral. I'm like, wow, like if
Wow.
it doesn't work, at least I'm getting some other kind of benefit.
That's amazing. I've never even heard of it. So we'll definitely be tagging her information,
Yeah.
and the information about it in the show notes. So, oh my
Yeah. I wish
goodness.
it
Yeah.
worked for me. And again, I think maybe part of my problem was maybe it was a little bit too late,
Yeah.
but it's a great rabbit hole to go down.
Yeah. I love me a good rabbit hole, and I love a good biohack. And you've mentioned so many that I love. And red light therapy. I mean, I find it really relaxing.
It is. Well, it
Yeah.
depends on who you are. I find it as well. I find that
Hmm.
you can use it for sleep. It helps me
Hmm.
with sleep. Great. But I have so many people who said it actually energizes me. It makes me alert. It makes me awake. And that kind of makes sense when you think about the way that it works in the mitochondria, and it improves your energy, and it's just taking it next level.
Yeah. So people who are doing it and they find that, have that experience, you're going to need to really look at the time of day that you're doing it. Yeah.
Hmm.
Because if you're doing it as a nighttime remedy, it might just, get you a little too jacked up to
Yeah.
really be able to sleep. So,
Another thing actually is that's interesting for people to try that worked for me for a while was ice bathing or cold therapy.
yes.
or contrast therapy if you want to kind of do hot cold, but it's an anti-inflammatory. It's
Hmm.
getting into really cold, and it you can try different degrees, of cold,
Hmm.
because I know it's very frightening to think of going into an ice bath, but it is improves your circulation, and that's why a lot of people may feel relief. When you think about athletes or football players or runners, or they're throwing their legs into an ice bath
Right.
after the game, right?
Right.
And that's because it's going to help relax the muscles, or at least get the inflammation down, because there's just so
Hmm.
much
So
damage
much
going on.
inflammation. And, there's a reason why people ice sore body parts, it works. But there's been some interesting research lately that, it's still good for women to do the cold plunge or the cold bath, but we don't need it as cold as men because we can't handle the cold as well as they can. So I can't remember, do your due diligence,
Yeah,
those who want to try
absolutely.
it. But yeah,
There is actually, I mean, so that's talking about ice bathing for, boost the immune system, let's burn
right.
some body fat, that thing. But when you think about somebody who's got a leg that's inflamed, they put their leg in, it's a little bit different. Yeah. Because, we think about if we're getting in the hole up into our neck, then yeah, our body is on high
Right.
alert. And
Alert and saying
like,
danger, danger. There's a lot going on.
exactly.
Yeah. I remember I had never really done it other than jumping into the lake by our house and things like that. And then 2 years ago, my husband and I were in Greece, and at the hotel we were staying at, they had a little cold plunge, and I had all mosquitoes love me. Talk about a rabbit trail, but mosquitoes love me. And my legs and feet were just annihilated. And so I got into the cold plunge, and then I had no itchy mosquito bites. I had no pain for like 24 hours. And I thought, okay, I'm loving that,
Cool.
the cold
That's,
plunge.
yeah.
So yeah, I'm an accidental, supporter of the cold plunge after my experience with the bug bite. So I thought it was pretty
Yeah.
cool.